Good afternoon, I'm Dr. Duke Machen. We are at the Duke Spine Institute. Our patient comes from New York. She has had an ACDF, and in that surgery they did a fusion. You could see it right there at C6-7, 2, 3, 4, 5, 6, 7. I'm going to be doing a endoscopic disc repair shot, AP. She does not want more fusion. Her surgeons in New York said, you need to fuse your whole neck. She said, no, I don't want a fusion. So here we are doing her surgery, repairing the disc rather than fusing them. Shot. All right, let's get started. If you have questions, Shot, feel free to ask me. I'll do my best to answer them. Shot. All right, AP. Looks good, lateral. I'm placing the needles right now. The first needle will be shot right above her fusion. Shot. And give me another AP. You all see the fusion, right? Metal plate, screws.
Yes, we do.
Good. All right, that looks good. I'm going to place a separate needle above. Shot. So we're going to do 2 incisions, one at C5-6, and then we'll do a second incision for 3-4-4-5. If you have questions, feel free to ask, but let's go ahead and show our video on what causes neck pain. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. That's awesome. Welcome back. And we are going to be repairing 3 herniated discs in our patient from New York. The first is going to be the bottom disc right above her fusion, C5-6, and then we're going to repair the disc above that. She's got basically 4 more herniations. She said that her surgeon should have fixed them all when he did the first surgery, but he didn't. And we talked about that a little bit. Sometimes surgeons only like to do one disc at a time. We obviously here at Duke Spine are comfortable treating all the discs at one time because we don't want our patient to have 4 different surgeries. It's better for the patient when you can treat all of them at the same time. Now, this is a surgery done endoscopically, I have to place this dilator over the guide wire, get it down on top of the spine, and then I'm going to bring the dilator through the disc to the back where the herniation is. And at that point, AP, we're going to bring in a small tube. We'll do the rest of the surgery through the tube using an endoscope. Quick shot. Perfect. We're right in the middle, which is perfect. You can see the tear. No, we're fine. She's got some pretty big herniations. You can see it on the MRI. And our job is to get in there and fix those. We're going to do it without putting metal. You guys see the metal there?
Yes, we do.
Kind of hard to miss, isn't it?
Very hard.
She says, I wish I had found you, Dr. Duke, before I'd had this surgery done, this fusion, because she regrets having the fusion done. She said she woke up from surgery and she had more problems. And while she was recovering from her fusion, she found Duke Spine Institute. Literally that same recovery period of the first surgery. All right. Keep an eye on the tip of that dilator. Shot. This is going to be the hardest to fix because it's right above her prior fusion. We call this adjacent segment disease because the disc above the fusion is now diseased, causing symptoms, and I'm going to go in there and work on this disc next to the fusion, adjacent. It's called the adjacent segment. Adjacent means next to. So you can have adjacent segment disease above, below. When you're operating and fusing 6-7, the most likely segment to go bad is the one above. All right, we're in. I'm going to bring the laser in with the endoscope, and we're going to remove the herniation, debride the annular tear, and get this lady on the road to recovery. Any questions? I'll get this.
Yes, we have a question coming from Mike. Yep, Mike on YouTube, asking, at what point is a cervical disc too degenerated that your procedure DLDR not appropriate?
Yeah, great question, Mike. So the question is, at what point is a cervical disc degeneration so bad that Duke laser disc repair won't work? Never. The disc can be completely degenerated and the DLDR still works. That's how good this procedure is. Never. And the reason is simple. What are you treating? You're either treating neck pain, radiculopathy, or myelopathy. And all those conditions can be treated with our Duke laser disc repair easily, no matter how degenerated the disc is. I haven't found a disc so degenerated we can't do the Duke laser disc repair. By the way, her disc is not really degenerated, it's just herniated. There's very minimal degeneration. That was a pretty big piece of herniation right there. You saw that?
Yes, we did.
Yeah. Nikki actually saw that thing. What was that? What hit the table? Guys? All right, let's just be careful. You got all these little pieces of herniation. I keep going down, finding more pieces of herniation and having to float them up. Guys, we need to keep an eye on the irrigation. We need to make sure it's working optimally. I don't want to have any issues here. No, not right now. Thanks. Here's the tear in the back of the disc we talk about. That's what causes all the symptoms, allows the herniation to occur. We need more laser energy, guys. I don't know what you guys are doing, but yeah. Just not having the effect it's supposed to have. Are you trying to minimize the energy?
Here? No,
Yeah.
no, it's supposed to be the same. You increase it?
That's probably a little better.
Thank you.
How much can this fiber take? This 0.5 millimeter fiber, does it say? Gotta find out. I'm sure it can't take 100 watts. Grabber. Look at all that herniation there. Lots of it. Any questions?
Yes, we have another question coming from Mike once more on YouTube, asking if the
It's
disc
a long
is
surgery. You gotta move quickly.
if the disc is so collapsed, can the discogram cannot be injected? What is
Nope.
your approach?
Yeah. Whether or not a discogram can be done has no bearing on whether or not we can do the surgery. There's no issue. The discogram just facilitates some things, but does not preclude the ability to do the surgery just because the disc is collapsed. There have been times I could not do the discogram because I couldn't get the discogram material out of the syringe because the pressure in the disc was so high. And that intradiscal pressure kept me from doing the discogram, but it doesn't keep me from doing the surgery. All right. It's just going to take forever. I have to keep going in with this grabber. Any other questions?
At this moment, no current questions, but we do have a comment coming from One Fast GXP on YouTube saying, "I hope the procedure goes well."
Thank you. We do too. I expect it to go well. Her disc herniations are pretty much almost identical. If you look at them on the MRI, there's not much difference in them. This one right here that I'm doing first is going to be the hardest, not because of the size of the herniation, but because of its location next to the fusion. It's that next to the fusion location that makes it more difficult because there's all that scar tissue that's stuck in behind the esophagus right up against the metal plate. That makes it a lot more difficult to get access to the disc from the front. But we've already achieved the access we needed, so we're actually doing pretty good.
No current questions, so we do have another comment coming from Mike once more on YouTube saying, "I'm sending my MRI and CT scan in next week, cervical and lumbar." Thank
Good.
you.
Yeah, thanks. I look forward to meeting with you and hopefully being able to help you. So what I'm doing is I've got the laser at the 12 o'clock position. Most of you can see it. It's a little bit subtle, but it's there. And I'm literally peeling herniation right off of what's called the posterior longitudinal ligament. You can see those fibers of the PLL down there. I've seen them all the time. They're right behind the annulus. This is a piece of herniation right here stuck in the foramen on the right at C5-6. This is the annulus right here. It's obviously been torn. wide open. There's some scar tissue and calcification right there. A little bit of bone spur developing right there. That's why it's blasting really bright when the laser energy hits it. It's like a flare or flash. That's actually the laser energy interacting with a bone spur. Very common. There's a piece of herniation right there, the blue thing. I'm just drilling it down with the laser. A lot of scar tissue. Go ahead, Henry.
As of now, we have no current questions, and we've already shown the 30 causes of neck pain. Why don't we show the audience of what causes discogenic neck pain and how it is that we cure it with this procedure?
Yeah, it's a great idea. So Henry is just telling you guys that we've already shown you the 30 different causes of neck pain. Of course, the disc herniations or disc injuries are the #1 cause. They're the most common reason people get neck pain. That was discovered at Duke Spine Institute through our careful work with our patients, diagnosing and treating chronic neck pain. And the second most common cause of neck pain is going to be your facet joint pain, which we're not treating in this patient. This patient doesn't have, watch your head, Luis. This patient doesn't have facet joint pain. She only has disc pain. And it's not even so much pain as it is compression of her spinal cord, myelopathy. She's basically losing function as a result of these herniations, function of her body, because her spinal cord is being squashed. And you can see that on the MRI. We call that myelopathy, dysfunction of the spinal cord. I could see why. The herniations are very big and they're pressing right on her spinal cord. Blood pressure is good?
Yes.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. Hopefully you can see from our animation how it is that a herniated disc causes so much neck pain. This patient doesn't have so much neck pain. She's more of a spinal cord compression rather than a neck pain patient. There's really 3 reasons to do surgery like this on the neck. One is pressure on the spinal cord. Number 2 is pressure on the nerve roots. And number 3 is neck pain. And when I say pressure, I mean pressure or irritation. Everything okay, Hector? Yes. Grab her.
We have another question
Sure.
coming from Mike once more on YouTube asking, if you have steroid injection in lumbar, how long do you have to wait before the DLDR? Thank you.
Yeah, you don't have to wait at all. You can have a lumbar epidural steroid injection today and have your Duke laser disc repair today. Yeah. There's no minimum time to wait. Steroid injections are never going to fix your problem, ever. They always wear off. The problem always persists. The only way to fix herniated disc symptoms are surgery on the herniated disc. See if you can ramp it up a little bit more. I just don't understand why. I don't know yet. Every time I go back in, I keep hitting the fiber. I don't know if it's just so zoomed in, the view. May also be the shape of the fiber, right? Guys? The shape of the fiber tip. You understand what I'm saying? Like if the fiber tip is uneven, like a mountain, then it may distribute the laser energy unevenly. You just keep hitting it and it keeps...
Can I have a...
That's why you gotta, time to time, you gotta cut it. Keep it smooth. Every time I go in, I keep pushing the fiber back in. I don't understand why it keeps catching. Look at all this herniation. It's just a massive amount of herniation.
We have a comment and or seeking advice from Mike once
Sure,
more,
yeah.
asking saying I'm scheduled for a C5-C6 and C6-C7 ACDF at the end of September. I want to see you first.
Yeah, I would too. You don't want an ACDF. ACDF is going to mess you up for the rest of your life. Don't recommend it. The only situation I can't fix with the laser is something called ossification of the posterior longitudinal ligament, which you have to have a CAT scan to diagnose, and it's very rare. But everything else that has to do with the disc problem, the laser is always going to be a better option, because we're not fusing. You got a small incision. You don't have problems with swallowing afterwards like you do with an ACDF. ACDF, you got metal, you got loss of movement, you got scar tissue galore, you have damage to your esophagus, damage to your trachea, damage to your nerves, damage to your voice box, all permanent. Damage to your spine, permanent. Everything is permanent, permanent, permanent damage. And they don't tell you all this ahead of time because they expect you just to go in and get it done. And when you say, well, what else is there? Because you got all this permanent damage, they're going to say, that's just part of the surgery. That's part of the surgery. Get used to it. There's no other option. You can't have surgery without permanent damage. Yes, you can. Now you can. They just won't give you this surgery because they don't know how to do it. And they're not going to recommend a surgery they don't know how to do. They want you to take your money and give you a expensive, invasive surgery that they do. And if you say laser, they're going to say, sorry, I don't do laser. It's a scam. Yeah, it's a scam because it works and they're not making any money off of it. Rather than doing what's best for their patient, these surgeons are always recommending what's best for them. That's what you have to be aware of. You, the consumer, you, the patient, you want the best treatment for you, not the best treatment for your surgeon. And in no planet, no time of the world, no history of the world is an fusion better than the endoscopic Duke laser disc repair. Okay, ever. That's like comparing an ice cream sundae to a case of herpes. And they're giving you the case of herpes and saying, this is what you want. No, it's not. Because herpes is forever. Once you have it, you're stuck with it the rest of your life. You can't get rid of it, no matter how bad you want to get rid of it. It's better to avoid it, not get it. Right, Luis? All right. I use that as an example because herpes, most people know herpes is a bad thing, right? You don't want to even have it. If you have it, you're stuck with it. Fusion is a bad thing. You don't want it. All right. Fusion's a bad thing. You don't want it. Once you have it, it permanently affects your neck and spine and soft tissues the rest of your life. And it's not a good effect. It's not like the Green Lantern effect. It's a bad effect. It's bad for you. It hurts you, harms you, makes you suffer. And they're not going to tell you that because they don't want you not to have their fusion surgery. I will tell you that because I used to do fusions, ACDFs. I've done 1,000 in my career. And I don't do them anymore because this is so much better for patients. All right, just about done. Then we're going to move on to the second disc out of 3.
We have about 2 comments.
Sure.
First one from Mike once more saying, I have a 2-month-old cervical CT scan.
That's fine.
Yeah.
Does it show OPLL?
That's a good question. If once he answers, I'll let you know. And till then, we will go to the next comment coming from Wesley on YouTube saying, I had lumbar surgery 6 weeks ago. Just want to say thank you, doctor.
You're welcome, Wesley. Hope you're doing well. All right. We are just about finished. I don't see any more herniation. It looks good. We're done.
2 more, please. Thank you.
We're going to irrigate it out with some antibiotics. Very dilute antibiotics, so not too concentrated. And then I'm going to irrigate out the antibiotics. Now, normally we would slide up to the next disc, but we're not going to do that. Not at this level here, because this is the one right next to the fusion. This is where the scar tissue is maximum. And if I slide this tube and I catch on some scar tissue, I could rip something internally, and I don't want to do that. So I've decided I'm just going to make a second incision. And that second incision will allow me to treat the other 2 discs. We're going to bring the X-ray machine back in. I'm going to make an incision we're going to go ahead and get the next 2 discs treated. A little pressure. All right, so again, these are 4 millimeter incisions. 4 millimeters. You guys see that? Tiny.
Yes, we did.
Shot. All right. You can see the guide wire coming out. Shot. Shot. That's what you got to be careful of, Luis. Shot. Great. Yeah. Shot. Unfortunately, we got a little vein right there. Shot. All right, so I'm making my way down to the next disc. So we've already fixed the one above the fusion. We're going to go for the next one above that. Shot. I don't need anything. Thank you, though. Give me an AP. Pressure. Any questions?
No current questions. There's a comment from Mike once more saying, I have pain, numbness, and weakness elevating both arms.
Yeah, Mike, I wish I knew what was wrong, buddy, but elevating your arms is unusual. I mean, I want to make sure you don't have a shoulder problem, right? And as long as you don't have a shoulder issue, if it's really coming from your spine, which it could, but that's why I do my Zoom call, because that's the only way to know for sure if it's coming from your spine. AP, take this, poker. But let's say it is coming from those 2 discs that you're talking about, then the Duke laser disc repair is the way to go. Thank you. There is no surgery on earth that even comes close. The recovery is the fastest. You're talking ACDF, if you're lucky, 3 months recovery. With this surgery, you're talking 1 day. You can go back to work the next day with some lifting restrictions. As far as results, this surgery gets rid of about 95% long-term of the neck pain, arm symptoms from the disc, whereas fusion is not done to get rid of neck pain, only gets rid of pinched nerves symptoms. This surgery gets rid of pinched nerve, pinched spinal cord, and neck pain. So ACDF is not a surgery done to get rid of any pain, just so you know that. It's only designed to get rid of weakness and numbness, tingling in your arms. Shot. All right, so I'm bringing the tube down. Also, ACDF, you're going to be on painkillers for weeks or months after surgery. They're going to give you narcotics. Narcotics are dangerous. They're addictive. People die from using narcotics that the doctors prescribe. Prescription narcotics, #1 reason for fentanyl and heroin addiction on the street. 80% of the street's heroin addicts are former patients that had back pain, neck pain. Doctors gave them pain pills, narcotics, they got addicted. Couldn't function anymore. Shot. Let's go, Jordan. We need a little more trigger happy finger up there. A little too long on the delay. Let's be generous. Shot. You see the dilator going a little further than I want. I'm going to pull it back. Shot. That's better. Got to control that tip of the dilator. You can see the herniation there. It's literally sitting inside the herniation. As long as it doesn't go past the herniation, I'm happy. All right, we're there. We're at the back of the disc. You can see it on the x-ray. Now we're going to go in again endoscopically and remove the herniation as much as we can, clean the annular tear, debride it. And then we'll move on to our last disc for this patient from New York, upstate New York. Anybody from Buffalo?
I'm from Long Island.
Long Island. A lot of Nayakas. Niyakis. Niyakis. Did you cut it?
I know it.
Huh? Let me have it. Any questions?
At this moment, no current questions.
I got it.
I want to know where Henry's from on Long Island.
Berndes says, where are you from, Henry? In Long Island.
Oh, Jericho, Nassau County.
I was born in Glen Cove.
He was born in Glen Morengi. I need to light up a little bit. This light is too dark.
Did I hear Glen
That's
Cove?
better. He said Glen Cove.
That's awesome.
Is that better for you? You want a little more?
No, the light's fine. Thank you. You can see all the inflammation there. You guys see the red stuff, the pink stuff? That was all inflammatory tissue.
You can see it?
That was her body trying to heal this thing, but not being able to, unfortunately. Flip. All right, Henry, what videos do we need to show the audience, if any?
So we showed them the 30 causes, we showed them what causes and how we cure discogenic neck pain. Why don't we show the audience of the second most common cause of neck pain, which is the facets, and what causes pain
I
for
love
that
it.
and
Do
how we
it.
cure it. Perfect, perfect.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that the facet pain is a very common cause of pain, and people injure their facet joints. Look at all that herniation. My God, you guys see all that coming out? That was all pushing on her spinal cord,
Yes, we did.
okay? It's fucking fiber. It just keeps getting caught. Look at all that. All that stuff's coming out. That was all squashing her spinal cord. That's all herniation. Look at it. Every one of those pieces of shaved ice that you're seeing, I just can't get in. There's something here that's blocking me near the mouth. It's blocking the scope. It's literally hitting the metal of the scope, preventing it from going down the tube. Let's get another tube. Aggravating. These are all pieces of herniation. Every one of them. You can see that's a big herniation there.
Yes, we do.
There's another piece working its way out. You guys see that? Right there.
Yes, we do.
She must have like herniated these one after another. This has got to stop turning. It's got to be this direction or this direction. And you know, the fact that it's too much tube, it's causing it to kink and roll and turn, and that's affecting the performance of my ability to get in. See this? I have to put, this is not circular, this is oval. So it has to go in with the wide part like this. If this is this way, this way, this way, it affects my ability to go in. It needs to be this way. Please fix it. Do it now. Don't worry about that. I don't need you to do that. Okay? I can do it myself. There's a lot you do I can do myself, believe it or not. I need you to do the things I can't do. All right.
We have another question.
Get this straight and keep it straight. Stop letting it move. Yes.
Coming from Mike once more on YouTube, asking if cervical facets are extremely degenerated, what kind of pain does it cause?
First of all, not everybody with degenerated facets has pain. Only some people. And the pain they cause is the same pain they cause in everybody. It's called facet pain. Pain is pain. So what you need to figure out is where it's coming from. Is it disc or is it facet? Because in the neck, when somebody has chronic neck pain, it's either disc or it's facet, 99% of the time, or it's both. And if it's both, we have to fix both. If it's one, then we fix one. But that's how we approach neck pain. We identify the source, and then we go and treat the source. Disc is Duke laser disc repair. Facet is Duke plasma rhizotomy. We need that irrigation pushing these fragments out. Otherwise, they block my view and they accumulate in the tube, and it's not good. A lot of herniation here. I gotta say, she has some of the biggest herniations I've seen in the neck. They're not just sticking out back big, they're also wide based. So it's like having not just a tall mountain, but a wide mountain too. There's a lot of herniation in a tall, wide mountain. A lot of dirt and rocks in a tall, wide mountain. That's what she has. Tall herniation, wide herniation. Wide base, they call it. Just like a mountain. Wide based. I don't know, guys. I'm just not happy with the performance of this fiber. It normally shakes all these little pieces out, and they're just not shaken out. All right, any other questions?
Yes, we just got a question from, forgive me if I'm mispronouncing this name,
Come on.
Meharab on YouTube,
Okay, Metarob.
asking, recently found out that I have cervical radiculopathy on its left side. I have 8 medicines, but pain is not going away. I am 30 years old now. What should I do?
What you should do is do our free MRI review, get a real diagnosis, what's wrong, and then get it fixed with us, Duke Spine. That's the best you can do in the world. There is nothing better. Taking pills, doing a therapy, waiting, doing chiropractic, there's none of those work. None. We know that because we've treated literally hundreds of thousands of patients with the same problem, They've all tried those treatments, believing that they're going to work, and they don't. So we have collectively hundreds of thousands, truly at this point, probably 1 million patients with chronic back and neck pain, and none of those treatments work. None of them cure the pain. None of them eliminate the pain permanently. What you want is permanent relief. You want to go back to a normal life. Only one thing in the world is going to give you that, the Duke laser disc repair. The treatment you're watching right now, and the Duke plasma rhizotomy. Duke Spine Institute offers a series of treatments that are unique. We're the only ones in the world that can perform them, and we're the only ones in the world doing them. But these treatments are designed to target the exact source of pain in your neck, whether it's a pinched nerve, whether it's an irritated nerve, whether it's a annular tear that's inflamed causing discogenic neck pain, whether it's facetogenic pain. We can actually go in and treat the source of pain so that it goes away and never comes back. And that's with one treatment usually, okay? That's what I would do if I were you. The other option might be a fusion. Fusions can work quite well if they're done properly. The only problem is they have very bad side effects that are permanent, and you don't want a permanent side effect from a fusion. All right, just about done with this disc. We're going to move on to the last disc in just a moment. But this was a pretty bad herniation. You can see the PLL fibers, another piece of herniation right there. I've taken out a lot of pieces of herniation already. There's not much left. This is a little bone spur right here. A lot of scar tissue right there. Huh? I think we're pretty much done. Take one more look here. Any more questions?
Yes, we just got another question from Mehrab once more on YouTube saying, I am from Bangladesh. Is it expensive, this surgery for cervical radiculopathy?
Yeah, this surgery is not cheap. Unfortunately, I wish it was. But in America, any spine surgery is expensive. The equipment needed, the staff, the training, the supplies, all the people here working to take care of the patients, it's all very expensive, you know. If my employees charged me $1 per hour to work and all the medicine was free and the equipment was free, then the surgery would be very cheap. The problem is everything is so expensive and the price is not getting any cheaper. It's just going up. I'm sorry, my friend. I wish I could tell you it was cheap, but I would be lying to you. And I don't lie. There's another piece of herniation. You guys see that? Just came right out of the foramen.
Yes, we did.
We're done. All right, we got one more disc to do. Take a look at this. Put the light on here. See all the pieces of herniation here?
Yes, we
See
do.
these, Henry? Little pieces right here, just laying on top of the skin. All those little pieces.
Yes, we do.
They float out of the tube from our irrigation suction. So I use the laser to release all the pieces of herniation. And I use sometimes the grabbers or the irrigation and suction to remove them. But they must be removed, and that's what we do. We remove them. I think she's going to do great. Got one more to do. Let's bring the fluoro back in. So at this point, we've already treated one disc with that incision. We're going to treat 2 discs with this incision. We're going to bring the fluoro in. We're going to move up the spine to the next disc, which is our last disc. Let's go. All right. Shot. Shot. Good. I'm removing the tube. Tube is out. I'm holding the dilator in place. Luis will take control of the tube. Shot. All right, tube's out. You guys see the tip of the dilator is where the herniation. Look where the herniation was, guys. Look at that white area. You guys see the little white, like mushroom cap on the side?
Yes, we do.
That's where the herniation was. It's gone now. Don't touch anything. Don't touch anything. All right, AP. Actually, I'm going to come out. Hold on. Shot. Here we come. Out. Outside now. We're outside the disc. Shot. I'm going to move north. I need to know if I'm left or right of the spine. Give me an AP view. Shot. I'm to the right of the spine. Don't take a shot. I should be more centered there. And shot. That's perfect. I need to be a little bit more centered. Maybe right there. Hold on. Shot. That's perfect. Lateral. So I'm going to slide up to the last disc and go in. And this is going to be the number 3-4. Okay, very good. So I'll slide up. What the, oh my God. She may have a pars defect. Can you go a little bit more north? Shot? No, I think she's okay. That's just the arch of C1. That was weird. It kind of looked like the top of C2 was sliding forward. An undiagnosed pars defect. All right, shot. Shot. All right, give me an AP view. I want that MRI up. I want to look at it one more time. Shot. Feel like I've gone too far to the left. Nope, that's perfect. Give me a true AP. Is that true AP? Shot? Yeah, it looks really good. Everybody agree? It looks good. It looks centered. That's amazing. Let's do this. Got one more disc to fix. Shot. Perfect. Here we go. Shot. Shot just means take an x-ray picture. Shot. That's what I say when I want to get a picture with the x-ray. Shot. Take. I'm going to clean this thing out, and then we're going to shoot a discogram. This is the last disc, shot, that we're going to fix. Shot. All right, perfect. Take. Any questions?
Yes, we have a question coming from Mehrab once more on YouTube, asking,
Shot.
does PRP or stem cell therapy...
Wait, before we take the question.
Yes.
Look at that tear in the back of the disc, folks. Look at that thing. See that black line? That's
Yes, we
the
do.
tear. That's where the herniation got out, right there. And you can kind of see the herniation. Shot. Let's go. Shot. Okay. Let's bring that tube in. I'll take the question. Shot.
Mehrab asking, does PRP or stem cell therapy work for cervical radiculopathy?
No, it doesn't. PRP and stem cells do not work for cervical anything. We've tried it. It doesn't work. Doctors are happy to take your money, but it will not work. If it worked, we'd be doing it. This is what works. But this is all that works. Shot. We used to do stem cell PRP on the cervical spine, disc herniation, facet pain, but it just doesn't work. And we don't believe in taking people's money and giving them a treatment that we know isn't going to work for them. Shot? Other doctors have no problem because they don't have a treatment that works. So you might as well do that because nothing else works. So you might as well do stem cell PRP because that doesn't work either. When you're a doctor and you have no treatment that actually cures pain in the neck, you might as well do treatments that don't work because that's what everybody else is doing. What they should be doing is sending these patients to Duke Spine Institute for curative treatment. But they don't do that because they don't want to lose the revenue. So instead of medicine being about do what's best for the patient, give them a cure, it's about do what we know is not going to fix their neck pain, but at least we make money doing it. And everybody else is doing the same thing, so it's okay. Right? That's what people believe in medicine. All right, I'm not having great visibility. Let's see here. Give me a second. Maybe I just have some herniation blocking the view. All right, let's go with the grabber. So no, don't do stem cell, don't do PRP. It won't work for the neck pain. It works for joints like knees, hips, maybe the SI joint. But again, it's only temporary. It's only going to give you maybe a year of pain relief. But pain always comes back. Shot? Good. Perfect. All right, we're at the back of the herniation there. You guys see it? And now we're going to start removing the pieces of herniation. Using the laser to release them off of the scar tissue. They're scarred down to the annulus. Do you know where she is?
No, she's in the ER last I heard.
Do you have that number?
Hector does. Get Hector. Hector can give it to us. Call Hector in the room. I don't have that number. I used Hector's phone.
Oh, I see. All right, any questions?
Just got a question as you asked that. It's saying, coming from Mehrab once more on YouTube, asking, I am frustrated and I don't know what to do. I am just 30 years old. Will it worsen as through aging?
Yeah, you're asking good questions, but you're not giving me enough information. I have no idea what's wrong with you. Huh? He's calling it cervical radiculopathy. We don't know if he has cervical radiculopathy. He says he has cervical radiculopathy, but patients are wrong 90% of the time. They have no clue what's wrong. They just assume. They either think they know based on their own research, or they have some doctor that told them something and that doctor's wrong. So what I really need to know is his diagnosis, which we don't have. The only way to get your diagnosis is to do your MRI review with me. When you're done with that MRI review, you will know exactly what's wrong and exactly how to fix it, my friend. Until then, you're just guessing. Hey, they may want to talk to me, Hector.
They called and they want to just get the family phone number, the phone number. They didn't say.
Oh, they're going to definitely want to talk. Can you find out who the doctor is? Huh? Just say I need to know the doctor and get their cell number so that I can call them and talk to them. All right. So yeah, the problem is, you can't self-diagnose what's wrong with you, with your spine, because 99% of the doctors are wrong, and there are some people that are really smart that are right because they do their research, and you may be one of them. I just don't know until I can confirm what's wrong with you. So when you ask me, will it get worse? Well, what get worse? I mean, I don't know what's wrong with you. I'm not going to just say yes because you want me to say yes, or if you want to know the truth, you have to do an MRI review. Okay? Otherwise, I'm just guessing. And I don't give advice to people based on guessing. I give them based on knowledge. Look at this piece of herniation just taking its sweet old time. You got to hold that too. Here's the tear we talk about. You guys see the tear down there? I'm cleaning the edges of the tear so that the disc will heal. It doesn't do any good for me to remove this herniation if she's going to have another one, right? As soon as she goes and does something. So what we want to do is we want this tear to heal. The only way this tear is going to heal is if I clean the edges of the tear. This is an absolute mess. These herniations, I can rate them on a scale of 1 to 10. And hers I give 10. Because the discs are so damaged by whatever trauma she had.
She does a lot of heavy lifting at work.
Yeah, I don't think that did it. The heavy lifting may actually make it worse, but the original injury must have been some kind of traumatic event. She's a very nice young lady. We just don't have the pressure I need there. Sam. Yeah, flip. I don't know. All I know is I'm struggling to get the pieces up and out. And the laser is just, I need more power on the laser. The suction's not the issue right now, it's really the irrigation. There's just so many pieces of herniation. And they're small, there's nothing. I don't know yet. I can't really see what I'm doing. There's so many pieces of herniation coming up. It's better when I hit it with a laser like this and then it's gone. That's when it's better. Like, do you understand what I'm saying? All this is herniation. Look at that. When I hit it with a laser and it doesn't do anything, that's when it's not enough power. You following me, Nikki? See when I have to like literally take 10 seconds just to hit one piece and get it to vaporize? That's not enough. There's more, just literally 100 pieces of herniation per disc here. It's unbelievable. She just shattered these discs, whatever she did. Whatever trauma she had to her neck, it was so forceful that it literally tore the wall open, which is what you're seeing here, but it also shattered the nucleus into 1,000 pieces. Look at all these pieces. I mean, most people have like 20. She has literally 100 per disc. It's just one of the worst cases I've ever seen. They have a name for this, by the way. Look at this, Nikki. See, it's just not doing anything. It shouldn't be like that. All these pieces should be gone by now.
Put it up to 28 hours.
Try more. these, which fibers are these?
This one are the cheapest.
Maybe that's the problem. We need to do a side-by-side comparison. Because if the fiber is not transmitting the laser energy through it, you know?
Yeah, I mean, when I order, we tested. They have like what do you call it? The technician have a test that the power that throw from the laser fiber, and that's why we start using this one. Because I start comparing with the other one.
Are you saying there's a machine?
Yeah, that tell you the power that the laser fiber is.
So where is that machine?
No, this machine is it's like a $3,000.
How much?
It's like a $3,000. Just a scan. I just told them.
$3,000? Then buy it.
You want it?
Yeah, I want to know if these, I want to test these fibers. Because if the fibers are not transmitting, then we need to get new ones
No problem.
or replace them. But, I mean, the worst place to figure out that is during surgery, right?
That's
Like these pieces of herniation should be gone. So, I want that machine.
no problem.
And do you know how to use it?
No. But,
Who's going to
as
teach
soon
you?
The technician.
Okay.
John, I go to John and it's simple.
John?
It's simple. You just aim to the to the screen and shoot it, and that's it. And they tell you the watts, and that's it. It's very simple.
So you can tell how much is coming
correct,
through.
correct, yeah.
All right.
How much is spitting out?
That's how they test the machine after they fix it and all that stuff.
Oh, that's what we need.
Yeah.
God damn these fucking fragments. Just keep blocking my view.
We have a comment and a question.
Sure.
Comment coming from Mehrab once more on YouTube, saying, went to a doctor, said they said I had cervical radiculopathy,
great.
gave medicine like Oxycam, Beclo, Neuropy, but pain is a little less, but constant. I felt pain in my upper back, not having soreness or numbness though.
Uh-huh. Yeah, that's not radiculopathy. That's not. You were misdiagnosed. Are you in America?
Bangladesh.
Yeah. That's not radiculopathy. You have the wrong diagnosis. Like I said, right? Radiculopathy goes down your arm. It's not in your spine. I can already tell you have the wrong diagnosis. Just what I was telling you earlier. You need the right diagnosis. It's no joke. 99% of doctors give you the wrong diagnosis. Who's kicking my leg?
I just put a towel in.
All right, we're almost done. I got literally 3 minutes left, Berndes. All right, any other questions for me? Look at all
Yes.
these pieces of herniation. They just keep coming out.
We see 'em?
Amazing. Yeah,
Next two
look at
questions.
that, another one. I mean, 2 more, 3 more.
Can't beat that.
Yeah.
This next question is coming from Jared on Facebook.
Jared's Jewelers?
Jared.
Oh, there's another one. You guys see all those herniations coming out.
Yes, we do.
Incredible.
It's
huh?
awesome.
Now, I also think that, just for the record on her, she said she woke up from her first surgery and she was worse. I think they probably cranked her neck during surgery, caused all these other discs to herniate worse. Look at that. I mean, that's the foramen. Now, see how the laser is shaking these guys out? See that? That's
We
what
do.
the laser is supposed to do. People don't know that about the laser. They think the laser just vaporizes. It does more than vaporize. It actually creates what's called a cavitation wave in the fluid, which then shakes things apart. And that's what gets those pieces of herniation out. I need that cavitation wave for the laser to work properly for my purposes. All right, let's flip it. And you said you have a comment or question?
Yes, we have two questions. First one from Jared on Facebook asking, why isn't this done at more hospitals around the world?
Well, it should be. First of all, this is the future of spine surgery right here. You're watching it. It's not being done because I pioneered it. And, well, number one, the alternative treatment is a fusion. And that, frankly, that pays surgeons a lot more money. They make 10, 20,000 US dollars for a fusion. I make about $500 for this surgery. So surgeons don't want to do surgeries that pay them less. We learned that lesson with artificial discs. When artificial discs came out in America, surgeons were being paid a lot less for an artificial disc surgery than a fusion surgery. So they didn't do the artificial disc surgeries, even though they were supposed to be better. Okay? Surgeons are going to do what makes them the most money, generally speaking, around the world. This surgery doesn't make them the most money. That's why they don't like it. Aside from that, it's a very difficult surgery to learn to do. You have to have somebody like me teach you. And I've been waiting for people to knock on the door and nobody's coming. 1 minute. Right, Henry?
Correct?
Can't teach them if they don't come.
Very true.
So the truth is, too, it takes about a year to learn how to do the surgery. What surgeon wants to leave his home or her home for a year to learn how to do the surgery? Not many.
Watch spine scans to get the answer to that question.
Yeah, if you want to get the real answer, watch the movie called Spine Scam. All right, we're done. 2 4mm incisions, fixed 3 discs. It was tough. This is one of the harder ones because the herniations were so bad, literally so bad. And, what? I couldn't hear you.
It is closed, no.
I don't know. You're going to make sure Nikki cleans it good.
Yeah, of course.
Any questions?
Yes, one more question coming from Ping on Facebook.
Yep.
Saying, what would you say is the motivation behind the UK and why they don't offer this? As unlike the USA, the healthcare is free over there, and they do all the standard fusions and artificial disc surgeries.
Ping, it's a great question. I respect your question. I respect you. The reason why the UK doesn't offer this, and folks, get used to this answer. The reason why the world doesn't offer this is because it works. If it works, that means more people will want it. The truth is, in the UK, even with fusion being free, if you go tell a patient, we need to do a fusion, and you have 10 patients, you say 10 patients, fusion. How many of those 10 are going to get a fusion? Only 1 or 2, because they read about fusion online, and they can see that fusion has a high chance of complications and bad results. This surgery you're watching now, Duke laser disc repair, does not. So what happens is 8 out of 10 patients recommended for fusion in the UK say, no, I don't want fusion, and they don't get any treatment at all. You understand? They just sit there and live with the problem. This surgery, on the other hand, is very effective, so the UK doesn't want to offer it, neither do the insurance companies here, because everybody's going to want it. All right, we just got to put a little pressure here to stop the venous bleeding. I'm just straightening out her head. She has a tube. She's intubated. She's asleep. We're going to wake her up right now, take her to recovery. She'll spend about an hour or so in recovery, and then eventually when she's fully recovered, she's going to leave and go back to her hotel. She is from New York, so we gotta see her tomorrow morning, see how she's doing, and then send her back to New York. If there's no other questions, you can run a testimonial, and then we'll see you guys on Thursday. with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Duke laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. That's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiezan a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Duke. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.